Hey, hi everybody, it's Bill MacPhee from Mental Health Recovery Blog. I'm your host, Bill MacPhee, and as you know, most of you, that our definition of recovery is when you wouldn't want to be anyone else other than who you are today. Today we're at the 168th Annual American Psychiatric Association here in Toronto, Ontario, at the annual conference. And with me here is a great guest that's done some work on insight. And as we know, with schizophrenia and sometimes bipolar, insight is really hard to get for some people. And just kind of to put it into perspective, with mental illness is that if I was to fall down and break my arm and a bone was sticking out of my arm, my brain would tell me that there's something wrong here. I need to get to the hospital to get my arm set and correct. However, as we know, with mental illnesses such as schizophrenia, insight is very difficult because when the brain is sick, it doesn't really let it doesn't know it's sick itself. And so that's why insight and battling insight and anything we're going to learn about it is very important. So with me here today is Dr. Philip Gerretsen, and Philip is actually a psychiatrist at CAMH, the Center for Addiction and Mental Health here in Toronto. So welcome, Philip. Thank you for coming on. And tell us a little bit about your research that you've done here and the poster that you've done for the conference.
Sure. Well, just to echo what you said, what attracted me to the area of insight and illness is that it has such a huge impact in my mind on the recovery in schizophrenia and other major mental illnesses that can feature lack of insight. And a big focus of my work in collaboration with my colleagues has been to understand which parts of the brain might be involved in lack of insight.
Okay.
And then to use that as a marker, a way to understand towards treatments for impaired insight in schizophrenia.
So were you able to narrow it down in the brain? What part of the brain is responsible for insight?
Well, I'm pleased to say last year the APA provided me with an award for my research as a resident, looking at which parts of the brain might be involved in insight.
Okay. Congratulations.
Thank you.
Yeah.
And the paper has finally been published, and the results seem to show that there's two key regions, primarily the left parietal lobe and also the left medial prefrontal cortex, which suggests that maybe the left hemisphere is more dominant in when somebody has impaired insight than it should be.
And you were able to tell this through what? Through imaging, through PET scans, CAT scans. So how were you able to determine what part of the brain is responsible for this lack of insight?
Yeah, thanks for asking that. That's very important because, as you can imagine, it's a very tricky concept to study. And so how we did it was, for each person that was willing to participate in this study, we assessed their level of insight. And we had a group of persons that had what we would say is good awareness that they're sick. They're aware that their arm is broken, to use your example. And then another proportion that weren't aware that they were ill. And we compared them in the scanner with an individually specific paradigm or task. And so they were confronted with their illness beliefs as we were assessing their brain activity.
Oh, okay. Oh, very good. Right. So I can see that. Yeah. So as you're asking those questions, and if they were, let's say psychosis or in a delusion, and they accepted that delusion as reality, then you would be able to tell by certain markers for experimenting in that part of the brain. Well, what was the size of the study of that, Philip?
Yeah, so it was what would be described as a pilot study, and in that we had 18 persons with schizophrenia. And it was broken down into a wide range, so from those with very severe insight impairment to those with very good insight impairment.
So Phil, so what have you been finding? So what are you finding out about insight, and was it specifically the schizophrenia population? It wasn't crossover with bipolar. It's specifically
it was
schizophrenia.
Yeah, persons with schizophrenia and schizoaffective.
And what were their ages? What was the age group?
And in that study, the age range was from 18 up until 65.
Oh, okay, 18 to 65. Okay. And so what have you found? And so tell us some of your findings regarding insight.
So moving on from that study, because again it's a major focus of my work, we've also looked at what cognitive variables or psychological variables might be related to impaired insight. Because the thought is maybe that if a person has their brain affected by an illness, maybe there's some cognitive domains might explain those that tend to have persistent impairment in their insight. And what the data shows, not just in the research that our group has done, but across different researchers that have insight as a focus, is that premorbid intellectual function, or IQ, and illness severity seem to be the biggest drivers of impaired insight, as well as executive dysfunction, in particular the Wisconsin card sorting test. In our work specifically, though, we wanted to see whether or not there was an effect of age, because we know that as people age, their cognition tends to decline in later life.
Right.
And that was the poster that I presented here today at the APA.
Before we get on to the seniors, so you're saying that it showed that people with a high IQ who were suffering from schizophrenia actually had less insight than others. Is that correct?
Actually, they tend to have better
Oh, they have better insight. Okay, so the higher your IQ, the better, more insight you have.
That's
Okay,
correct.
that's fascinating.
or capacity to regain insight.
Or capacity to gain insight. Okay. Now, were these the studies? Were some of them, like as we know with schizophrenia, you can have acute onset, which means we're basically in a very short period of time you become. People notice a big difference in you, whether you're delusional, having hallucinations, paranoid, but quite a short period of time, rather than going into a slow onset, or where parents may think it's a phase or isolation, or they may be experimenting with drugs or something, or a fad, but they don't really jump to the conclusion of schizophrenia. So, talk a little bit about insight regarding acute schizophrenia and long-term onset of it.
If I understand correctly, I think what you're pointing to is the fact that if you intervene early and a person gets treatment for their psychosis sooner rather than later, they tend to have
Yes.
better outcomes.
Absolutely, yes.
And there's not a lot of data out there that has explored that in relation to impaired insight. But based on our findings in relation to cognition, in particular premorbid intellectual function, one would think that maybe if there was more timely intervention early in the illness, or even before the illness develops, in the prodromal phases that is, that we might be able to improve a person's recognition that they're sick, which would have a lot more advantage in terms of better long-term outcomes.
Right.
Where families and patients themselves wouldn't have to struggle day to day with whether or not they accepted their will or the need for treatment.
Right. Very good. Yeah. Now, you talked about the cognitive, a big part of the cognitive aspect of it. Talk a little bit about that. When people are dealing with mental illnesses, and basically cognitive just really means their functioning of their brain in an area of being able to get things done, maybe the concentration. So talk a little bit about that. Talk a little bit about what that means as far as that.
Sure. From the research that's out there, I think it's widely accepted that persons with schizophrenia tend to have general global cognitive impairment less than that would be expected for a same-age individual.
And it shows how. How does that show? What are some of the signs and symptoms of poor cognition?
So a person might have problems if it's related to their planning or judgment. They might have trouble making decisions with motivation, which is also described as a negative symptom.
Yes.
And so just to carry out day-to-day activities becomes much more of a chore.
Right.
And even the more challenging day-to-day activities that people are obliged to take care of, like taxes, getting on the subway, finding their way to work, etc., keeping up with all the demands in a workday, those become particularly challenging for a person with psychosis and schizophrenia.
Now we talk about cognitive as being, well, when we look at schizophrenia and symptoms, we talk about positive symptoms, the things that are added to your personality that shouldn't be there, the hearing of the voices, the chemical imbalance. You may be paranoid, delusions, illusions, hallucinations. All this stuff are positive symptoms of schizophrenia. With negative symptoms, we have like lack of motivation, a lack of drive, emotional bluntness, no interest, different things like that, lack of energy, depression can set in. Where does cognitive fall in there? Is cognitive more of looked upon as a positive symptom or a negative symptom? Can you speak to that a little bit?
I think where we're at contemporarily is that people tend to see it as a domain related but independent from those other two.
So it would actually be a third class. So we'd have positive symptoms, negative symptoms, or deficit symptoms as they're called, and then cognitive symptoms. Is that correct?
I would agree with that.
Okay. Good.
And then in relation to insight, I would argue that insight or impaired illness awareness is a domain independent of all of those as well.
Oh, okay.
That heretofore has been neglected in the research
Right,
community.
right. Now, can you talk a little bit about the percentages of, say, insight? So if what percent of people who are diagnosed with, say, schizophrenia have insight into their illness and can understand that they do have an illness and that they do need treatment, they need to be continued treatment. So talk a little bit about those statistics.
Sure. So there was a large World Health Organization study that showed that 90% of, actually more than 90% of persons with schizophrenia had impaired insight at some point in their illness.
Yes.
And more than 50% had moderate to severe insight impairment at some point in the illness. And I would say those are the two stats that get presented the most in terms of characterizing what a severe problem it is.
Right, and it's probably true to say that people who are first experience psychosis or slow onset, different things, would have that impairment, that lack of sight at a certain point in time. But it will get better, or as they get educated, or their symptoms go away and they realize it's a chemical imbalance, whatever, that eventually, so when people are starting out, it might be 100% of lack of insight, but as they go through their recovery, they gain that insight in some ways. Is that correct?
That's correct.
Okay.
I would say there's a substantial portion of persons with schizophrenia that, as their illness improves, say after that first episode, to use your example, they start to gain insight into the fact that they're sick and that they need treatment. And those persons tend to do fairly well in comparison with those that, although their illness has improved,
Yes.
they still maintain that their experiences were real and that they're not sick.
Right.
And those are the persons that I'm particularly concerned about, because they tend to stop their treatment and then have a revolving door or multiple relapses leading to problems not only for them but for their family.
They get feeling good and therefore they say, I feel good, so why do I need medication? And they just stop their regimen and then they get sick again.
Exactly.
And that's the revolving door. Now you said that you studied all the way up to the age of 60 to people who were 60 years of age, correct?
Yeah.
Tell us some of that stuff in elderly people then. Well, I guess 60 really these days are not elderly, as we have a long life expectancy longer. But say people in their 60s, what have you found?
Yeah, so the original study looking at which brain areas might be involved was focused in those less than 65, so across midlife, let's say. But in the poster presented here, we focused across the lifespan, so from 18 all the way up until age 79. We wanted to look at what were the differences between insight in those younger, in midlife to early life, in comparison with those in later life. And what we found is cognition seemed to have a bigger effect in those in later life when insight tended to worsen. So if you were to compare those older than 60 versus those younger than 60, they have worse insight than, that is, those in later life have worse insight than those in earlier life. And it seems that cognition plays a bigger role in that population, specifically with working memory. So in early life, working memory doesn't seem to play a big role in insight impairment, whereas in those in later life, it seems to have more of an effect. And what that means is that if you tend to have worse or working memory deficits, I should say, then that seems to have an effect on how impaired your insight is.
Oh wow, very interesting. We tend to say that, and this might have something to do with the elderly people, is that we see sort of a trend saying that as people live with their illness for over the years and a long time, that they seem to do better as they get older, because maybe one of the is that they're used to their illness. They're used to it, and they just go through life with their same routine, and they're used to that. But you're saying that the cognitivity in seniors or at age 60, 70 was actually worse, and so that's not then that's a myth, really, that they get used to their illness and they're managing better. Is that what you say? That's a myth then?
It's hard to link the two, I would say, because something that might be related is that in our study we also found that illness severity tended to be the same. So when you compare midlife to later life, there's no worsening of psychosis. It tends to, again, be stable. But where we did see a difference was in the phenomena of insight. It tends to get worse in later life.
So with your study, tell us then the conclusion, or what practical steps or what practical knowledge and information that maybe caregivers who are giving to people with mental illness with lack of insight, what practical conclusions can we come from your study, or that we can come and be helpful as far as when it comes to insight? Because obviously one of the major things with insight is what's so frustrating is that we're here and we're talking logically, right? I'm making sense, you're making sense, we're logic. However, if one person was out of logic, which happens with psychosis and delusions and paranoia, people speak and they're not logical. So what does, and they may have lack of insight. So where does the rubber hit the road? What can we take away from this and further study and further have practical ways to cope with lack of insight?
First, I should say that I think it's really important that families and patients or loved ones of patients know is that insight is a very real phenomenon, and they know better than researchers or physicians the impact that lack of insight can have not only on the patient's life but on their lives, and that now we're starting to take it seriously. And I think what our research is showing that it's a key area that needs to be addressed, and if we intervene early and possibly later in life when cognition starts to have an effect on one's understanding of their illness, then maybe there's hope in terms of leading to better outcomes, not only again for patients but their families and the help that patients can get, because if they can recognize that they need treatment, then it makes their life easier and then also their family's life easier.
Thanks, Philip. Before we wrap up, Philip, would you like to add anything else or any comments before we wrap up?
No, I just would like to say thank you for your time and showing interest in this very important phenomenon.
Very good. You're welcome. So we're going to cut it here, folks. And as you know, our definition of recovery is when you wouldn't want to be anyone else other than who you are today. And remember, there is life after mental illness. Philip, thank you for coming on to our blog.
Thank you.
Thank you.
Much appreciated.
Bye-bye, everybody.